Hi, I'm Dr. Steve Yip. I'm a GU Medical Oncology Fellow working with Dr. Kim Chi and Dr. Alex Wyatt at the BC Cancer Agency in Vancouver Cancer Centre in Canada. And here we are at ASCO 2018, and I'd like to present to you treatment outcomes in patients with DNA damage repair mutations and metastatic castration-resistant prostate cancer. We now appreciate that hereditary prostate cancer is a much larger problem than previously understood, where we find that 15 to 30% of individuals who have advanced metastatic castration-resistant prostate cancer can have DNA damage repair mutations, potentially affecting ATM, BRCA1 and 2, for example. So what we wanted to examine was to characterize these individuals who had DNA damage repair mutations in comparison to those individuals with control wild-type status who did not have these mutations. We were able to consecutively sequence these individuals who had DNA damage repair mutations and compare them to control wild-type patients with next-generation sequencing, examining for germline and somatic mutations. And we compared them for a variety of outcomes, and in particular what we found in 74 individuals who had DNA damage repair mutations, either germline or somatic, when compared to control wild-type patients, was that these individuals who had DNA damage repair mutations seemed to have shorter time to CRPC or castration-resistant prostate cancer when compared to control wild-type patients. They also seemed to have shorter time to PSA progression on first-line androgen receptor-targeted agents when compared to control wild-type patients. Overall survival, when taken from time of androgen deprivation therapy for metastatic disease, was worse in these individuals who had DNA damage repair mutations as compared to those individuals who had control wild-type status. When we examined other forms of therapy for first-line and on CRPC therapy, we looked at how they did with other forms of therapy such as docetaxel, PARP inhibitors, and platinum-based chemotherapy, as well as radium. What we found were favorable responses in those individuals who were treated with docetaxel, with PARP inhibitors, and with platinum-based chemotherapy. So overall, our findings are that those individuals who have DNA damage repair mutations, either germline or somatic, seem to have worse outcomes in time to CRPC as well as their time to PSA progression on androgen receptor-targeted agents such as abiraterone or enzalutamide. We see that they have favorable responses, though, when we treat them with docetaxel, PARP inhibitors, or platinum-based chemotherapy. So overall, it seems that these individuals do more poorly, but we do have effective agents that we can consider in their therapy. Thank you very much for listening to my talk.